When you or someone you love is diagnosed with breast cancer, it feels like big decisions must be made right away. How will you pick your doctors? What comes next? I'm Aileen Ellis, and here to answer these questions is Dr. Carolyn McGugin, a fellowship-trained breast surgeon with Infirmary Surgical Specialists in Mobile, Alabama. She specializes in the multidisciplinary treatment of breast disease. Doctor, how is breast cancer diagnosed?
Typically, it's either found on a woman's annual screening mammogram, or she might feel a lump in her breast. But either way, you would get imaging and then typically a core needle biopsy, and that's often done by a radiologist. And then it's on that biopsy that they would diagnose breast cancer. And then typically from there, whether it was your primary care doctor or your OB who really initiated that workup, you typically get referred to a surgeon first, maybe a medical oncologist, to kind of discuss where to go from there.
And how can women best prepare for that first special doctor's appointment?
Understandably, when you get that diagnosis of breast cancer, it can be very anxiety-provoking. And so that first appointment, you're going to hear a lot, and sometimes that information can be overwhelming. And so I really recommend that when patients come, that they bring someone with them, whether that's a spouse or a sibling, a friend, but someone who can be with them and really help absorb all the information, even write things down. I think that's helpful. And then just kind of overall, when you're preparing for that first appointment, really trying to first take a step back and allow yourself time to really meet with your doctors, allow yourself time to understand your disease, understand what treatment options you have, and really finding that right treatment team for you, allowing yourself time to really take that step back.
And do you recommend that people do some reading ahead of time before they have that first doctor's appointment, or is it just best to kind of relax, take some space, and then have the doctor go from there?
I think it can go either way. Certainly when you read things online, a lot of times it can just cause more anxiety and more fear. But I think if you're someone that's going to look, I would recommend trying to absorb things, and maybe that can help come up with some questions you might have. But really, I think the most important thing is coming, and when you meet, as a breast surgeon, I'm often kind of the first physician that does speak to patients about their diagnosis. And so, I don't really recommend that you go on and read, but if you're going to, I think kind of understanding that there's sometimes a lot of that information can just lead to anxiety, and it can really help if we just focus on your type of breast cancer, because the treatments and everything can really, really vary depending on what your diagnosis is.
So, although you're first diagnosed with breast cancer, that doesn't necessarily mean that we know what kind you have initially from that biopsy. Is that true?
There's a lot of things that will go into determining really kind of what stage breast cancer you have and things like that. We really look at now we kind of term the biology of your breast cancer, and that goes from everything from the size to the grade of the tumor, what the hormone receptors are, whether there's cancer in the lymph nodes. All of these factor in to be breast cancers that will be treated in different ways. And so once you have your diagnosis, we typically have that information, but we might recommend additional imaging or things like that based on what we see or what we feel on exam. And so it's possible when you go in that we have all the information we need, but it's also possible that we're going to recommend either additional biopsies or additional tests or images. It really just depends.
And how should one look for a treatment team that then will follow up with more information and a plan? And also, why is a personalized approach important?
I'll kind of start with who really makes up this treatment team. Breast cancer is treated with a multidisciplinary approach, and it's important to realize that it's going to be treated kind of in separate different pieces. And so really who makes up that team, it's going to start with the radiologist, right, who did your images, who might have done your biopsy, the pathologist that looked at those slides, surgeons, so a breast surgeon, maybe a plastic surgeon, radiation oncologist, medical oncologist, there's genetic counselors and nurse navigators. And so it's a large team. We all meet, and this is where the multidisciplinary part comes into play, is that The treatments will typically involve surgery, and that's a lumpectomy or a mastectomy, and usually some type of axillary procedure. And what I mean by that is, sampling some of the lymph nodes. Sometimes you'll get radiation, sometimes chemotherapy, sometimes hormonal therapy, and what treatments you get and the order of these treatments is going to depend on that kind of cancer you have. So it's really important when you're looking, for a treatment team that these physicians come up with a personalized treatment plan based on the biology of your breast cancer. And that's what I talked about before. And also your factors. So your age, overall health, life expectancy, and your preferences, because, we're going to be treating the whole patient. And so you really want to work with that team that's going to come up with this plan that's in line with your values. And that's usually going to be, maximizing survival, minimizing unnecessary side effects. But you want to make sure that you really are comfortable, that you understand what's going on, and that they've taken all these factors into account to come up with a treatment plan that's best for you and your type of breast cancer.
And once a patient is in that pipeline with a treatment team, how should the patient intervene in their care as things go on?
Yeah, so I think it's really important to ask questions if something doesn't make sense. And I really stress to my patients that I really want them to understand their disease, and I want them to understand the whys for everything. Why we're recommending one surgery over another surgery, or why the radiation oncologist thinks you need radiation, or maybe thinks you might not need radiation, or why the medical oncologist is recommending that you get chemotherapy before surgery or chemotherapy after surgery, or maybe not even chemotherapy at all. But I think really making sure that you understand what options there are, that you understand what we're recommending, and that you understand why we're recommending it. I think that can be very helpful in what I recommend.
Anything else you'd like to add?
Fortunately, most of my breast cancer patients are going to survive their cancer. And you're going to have a long relationship with your doctors. We're going to be with you from the time you're diagnosed through your treatment and for years, if not longer, into your survivorship. So you really want to find that right team for you that you're comfortable with. I can say a little bit about my approach in that I'm a breast surgeon, so 100% of my practice is devoted to treating patients with breast cancer or those at high risk, and I do treat some benign breast diseases. But I think when you work with a group that's specialized, we're able to stay on top of really the most current research and really focus on this field that's changing a lot. And I think that's really important.
Thank you, Dr. McGugin, for this valuable information today. Dr. Carolyn McGugin is a fellowship-trained breast surgeon with Infirmary Surgical Specialists in Mobile, Alabama. I'm Aileen Ellis. If you've been recently diagnosed with breast cancer or are concerned about your risk for breast cancer and would like a formal evaluation by a breast cancer specialist, call the Infirmary Surgical Specialists High-Risk Clinic at Mobile Infirmary for an appointment. The number is 251-433-5557. Thank you for joining us today for this podcast from Infirmary Health.